We know that the quality of care for underrepresented patients actually may improve if they're taken care of by physicians that look like them.
I've always wanted to be a doctor.
I would prefer going into surgery, but all I want to do is help people.
This program was born out of an observation that there weren't a lot of people of color in the medical school. I saw that Detroit was 35 miles away, and I didn't understand why we weren't getting some of these really smart kids from Detroit. It made me realize that there was a disconnect, that we weren't doing enough to reach out to them.
These students are remarkable. They go to Cass Tech because they are bright. They're motivated.
We got to work with the Da Vinci robot, and it was like robotics, so that was really cool.
You can just see them beaming, and they really start to get this feeling of, I can do this.
Programs like this give the students an opportunity to see that they're in charge of their futures.
I knew I wanted to go into medical school, and Doctors of Tomorrow, they offered me that inside look into the medical school.
It helped me to stay focused, and by doing so, inspired me.
Part of this program is meant to encourage them to be leaders and change agents in their community.
Regardless if it's a big impact or a small impact, I'm helping somebody at the end of the day.
Being able to be part of Doctors of Tomorrow and help run it has been a reminder of why I go into medicine.
Almost all of them will tell me that this was absolutely their favorite thing that they did in medical school, and it's my favorite thing that I do.
This is great that it happens at the University of Michigan, and yeah, it's great that it happens for Cass Tech, but these type of programs need to happen at all the schools in Michigan.
My name is Dana, and I'm gonna be a pediatric emergency physician.
Cardiothoracic surgeon.
Pediatrician.
Surgeon.
My name is Tomorrow, and I am a doctor of tomorrow.
Hi, my name is Avian Mohammed, and I'm a freshman at Cass Tech High School. I'll be answering two questions. One question is, what do I want to be when I grow up? When I grow up, I want to be a dermatologist because it always resonated with me. The second question is why I believe diversity is important in medicine. Me personally, I believe it's more important because a lot of people of color patients, when going to hospitals, especially with white doctors and white nurses, they feel like they're being mistreated and undiagnosed when they're there because doctors tend to disregard their feelings. So with more people of color doctors, the patients may feel more comfortable and may go home feeling better because they're being listened to. Thank you for your time.
Hi, my name is Antoine Bailey. This was my first year at Doctors of Tomorrow. Doctors of Tomorrow, it was helpful for a lot of things. It took my mind off a lot of things, and it got me to build more experience with new people. It was pretty good overall. The workers there were great. The people were always trying to help. You had mentors to help you. And the Doctors of Tomorrow, it taught me a lot of things about the medical procedures and stuff that I would need to do and how I would help people and more stuff like that. Yeah.
Hi, my name is Arif Ahmed, and I am a freshman in high school. How has the Doctors of Tomorrow program helped me? Well, the Doctors of Tomorrow program has expanded my knowledge of the medical field and provided further insight for careers in the medical field. The events held by the program have allowed me to learn more about certain aspects of the field of medicine from experienced people who have careers in medicine. I have also learned about a multitude of health problems and diseases, and how a medical professional treats patients by having an understanding of those health issues. As I continue to participate in the program, I hope to further expand on what I know of the medical field now.
Hi, my name is Iqri Guzman, and I'm in my freshman year of high school. Diversity in medicine is important because it's about understanding the mindset of patients within a larger context of culture, gender, sexual orientation, and religious beliefs. Diversity also creates a stronger feeling of inclusion and community for healthcare workers, which make the workplace feel safer and more enjoyable. Mentorship is important in medicine because mentors are motivators who act as guides for students in their professional development areas. Mentorship experiences impact students' decisions involving residency programs and fields of practice.
Hi, my name is D'Anthony Givens, and I'm a 9th grader at Cass Technical High School. The DOT program has been beneficial to me by not only increasing my knowledge in the medical categories it is featured, but by also involving its members in activities like what to do when a patient comes in about a complaint or an issue they have. The topics would be about the specific medical branch, like urology or cardiology. Those many activities would help me learn what to do when a patient comes in and how to know to treat them with the correct medicine. The DOT isn't just a place for helping many people become future doctors or helping the medical field. It's a foundation helping young students, medical students, and more to becoming the best doctor they can possibly be by holding meetings and gatherings in small groups and even in pods to talk about or get help about what to expect in medical school. This program helps students become the best they can possibly become.
Hi, my name is Deja Smith, and I'm 13 years old, and this is my first year at Cass Technical High School. What I want to be when I grow up is I want to be a type of surgeon, and I think the Doctors of Tomorrow program will help me figure out what type of surgeon I would like to be, because I haven't quite figured it out yet. And what has inspired me about a future career in medicine is that when I was younger in elementary, I would always like to help people with stuff in classes and stuff, like either if it was a homework assignment or it was something personal going on at home where they got to cry in class, and I would just always go over there and try to figure out or help out if they wanted to tell me what happened so I could fix it. And most of the things that they had told me, I've tried to figure out and help them be better in themselves and make them feel better, or actually help them out if they're stressed over homework assignments or anything. And yeah, some of those I have completed or actually tried figured out how to help them, and most of the things I recommended them a type of help that actually helped them. And yeah, again, once I'm 13 years old, my name is Deja Smith, and this is my first year at Cass Technical High School.
Since my 9th grade year of high school, Doctors of Tomorrow has been very influential in my life. When I started college, I thought it was all about academics, but I quickly realized that college is about the support system that you have around you. I thank Doctors of Tomorrow for being a strong support system around me. Not only were they helpful in finding internships and volunteering, they were there to mentor me on what it's like to be a college student and how to maneuver in the world. I also thank Doctors of Tomorrow and the rest of the team for all the medical exposure that they gave me, which deepened my love for medicine. And for that, I am eternally grateful to all of you and what you have done and continue to do in my life. And for that, forever go blue.
Hi, my name is Sanaya Irani, and I am the current Director of Operations for Doctors of Tomorrow at the University of Michigan. Throughout my journey to medicine, I have been super fortunate to have many mentors along the way who were really invested in my journey and motivated me to reach my full potential. As a previous teacher in Detroit Public Schools, I have worked with numerous students and have witnessed their true potential, and I feel that every student deserves an opportunity to be mentored and to be exposed to different career paths. Through Doctors of Tomorrow, our students are able to work with mentors from a young age and also meet numerous physicians in different specialties. Doctors of Tomorrow is truly creating the next generation of diverse physicians and allows students to have the tools and skills as well as the mentorship right from the get-go to go through high school, learn about medicine, get into undergrad, and then eventually apply to medical school. I'm super fortunate to be able to be a part of this program this year, and I'm excited to see what Doctors of Tomorrow continues to do in our community. Thank you.
Hi, my name is Amir Katsun, and I'm a senior in LSNA, finishing up my last semester on campus. I've been part of Doctors of Tomorrow since my freshman year in high school, so it's been about 8 years now, and I am super thankful to be part of this wonderful program. One of the main reasons is the mentorship that is provided for me. I'm a first generation student in my family and also the first person to think of going into the medicine field. So it's been really helpful to have mentors that have also done the same path that I'm going into, or even like different paths, but like it's interesting knowing those type of paths for me, and to have them be there for me, either for my resume building or to look up internship or connect me to different research opportunities is really like helpful. And to have this mentorship is the main reason that I'm not as stressed as I would have been if I went in blind. So yeah, thank you.
Good morning, afternoon, or evening. My name is Lamba, and I am a CASTEC freshman and aspire to be a cardiothoracic surgeon. As a young student, I've always seen myself working in the medical field, whether it be a nurse or a biomedical engineer. I've always sought to help or aid those who couldn't help or save themselves. And this may be a factor of the fact that my mother, she's also a nurse, and as an immigrant, both of my parents, they have thrived with little to nothing. And I just see them as really huge role models in my life, and I'd love to help others the way that other people can't help themselves. So, thank you for watching.
Hi, my name is Janela Coleman, and I am a freshman at Cass Technical High School. DOT has helped me learn a lot about different medical careers, and it has also helped me learn about what I can do to get into medical school, what colleges I could attend, and other helpful things to help me with my wanting to be in the medical career. Diversity is important in medicine because everyone, like especially within the Black community, it's kind of a distrust with certain medical procedures. So if more people, your color or your diversity, are in the medical field, I feel like people will be more comfortable going to hospitals.
Hi, my name is Arif Ahmed, and I'm a freshman at Cass Technical High School. Growing up, I've always seen how fond people were of little kids, and I think that's where my little spark of becoming a pediatric NP kind of came from. At first, I wanted to be a pediatric, full-on pediatric. However, I realized that they won't really have much connection with the patients as much, so I decided to take the nursing role instead because I actually want to comfort and take care of the kids. Upon enrolling into DOT, I was really unsure of whether I should really take this path or if I should take an easier path. And I realized going into the medical field, period, isn't going to be an easy feat. But me having opportunities like this, it really means a lot. It's a great thing. And it reassures me a lot that I have programs like DOT to push me into taking the path that I want to take. The mentors, the lessons, the people that I meet, they've all been so sweet and so encouraging, and honestly, it means a lot. So I'm very glad that I was able to stumble upon DOT's amazing services and that they were able to reassure me of the career path that I wanted to take.
Hello everyone, my name is Leah Coleman and I go to Cass Technical High School. This is my first year and I am a freshman. Doctors of Tomorrow has been very helpful. It has given me another way to get closer to the medical field, so I actually have a chance of achieving to go to a medical school and pursuing the medical career that I would like. And when I grow up, I just want to do anything to work with kids. My mom owns a daycare, and it would just be cool to have a connection with younger people because I knew I was there before, and to help them be able to grow up and be who they're meant to be. So thank you, and thanks for listening. Have a nice day.
To me, Doctors of Tomorrow program was more than just a program. It was a community. It was my identity. It was an opportunity for me to prosper and grow and become independent. The Doctors of Tomorrow program helped me get to where I am today. It helped me realize what I want to be in the future, what career I want, and if I really wanted to be in the medical field. It was more than just getting to know people. It was getting to experience things hands-on and getting to know what my limit was and what I really had in mind for myself. It was a chance for me to understand who I was as a person and get to know people who were just about in the same area as me. I was able to make so many friends and connect with so many people through Doctors of Tomorrow. So this program is just more than that, a program. It is a community. You get to network with your friends and mentors and people in the medical field to get to know them better, to know if this is really the passion that you have for yourself in the years to come. It was the best decision I made to join this program. So I'd really say it really impacted my life and helped me become the person I am today. And I'm grateful.
Hi, my name is Jasmine Beer, and I'm a 10th grader at the school at Marygrove. And when I grow up, I would like to be a pediatrician. And what inspired me to be in the field of medicine is being able to help people with their health in any type of way. And I believe that mentorship in the field of medicine is important because you can rely on your mentor when you have questions or concerns.
Hi, my name is Jessica McLeod. I'm in the 9th grade, and the Doctors of Tomorrow program has helped me because it taught me the steps it takes to get into medical school.
Hi, my name is Karen Hoy, and I'm in my 3rd year of medical school. To me, diversity in medicine is important not only to best care for the increasingly diverse patient population that we'll serve, but also to best support students and trainees. There's a certain sense of ease and confidence that you feel when you can talk to or work with someone who looks like you or has a story like yours. Mentorship as a tool to support diversity in medicine is so critical because there are so many points in the trajectory from high school to becoming a physician where it can feel like this career is not meant for women, for first-generation students, for those who identify in certain racial ethnic backgrounds, or for those with multiple of those identities that intersect. Mentorship can help it feel like those moments are surmountable.
Hi, my name is Kennedy Dawson. I go to Cass Technical High School, and I'm in the 9th grade. When I grow up, I want to be an OBGYN or a surgeon. I would like to be a surgeon because surgery excites me. Whether I see it in shows or movies, it just gives me like an adrenaline rush, I could say. Like it just looks so interesting, and it just looks like something I want to do. I want to become an OBGYN because I like babies, and I just want to, help people be able to, give birth to them, I guess you could say. Doctors of Tomorrow has helped me because it gave me insight on many different doctors and many different just parts of your body that are so useful and have many uses, and it just gave me a whole bunch of information that I can use for whenever I grow up to be an OBGYN or a surgeon. Thank you.
Hi, my name is Kristen Ray Farley, and I am in the 9th grade. I want to be a veterinarian when I grow up. Doctors of Tomorrow has been very helpful for me because it gives me the knowledge and experience I need to become successful in medical school and my career.
Hi, my name is Madison Barnes. This is my first year at Cass Technical High School. My question was, why is diversity in medicine important? It's important to me because being of African American descent, it sometimes gets suffocating to be able to talk to a Caucasian doctor about the struggles that I'm having internally and externally. Sometimes it gets hard not to tell her, but you also don't want to create tension and you don't want to feel uncomfortable or make the other person feel uncomfortable. So you just don't say it, you keep it to yourself. But in the medical field, we need more students of ethnic backgrounds because it'll make the patient feel more comfortable. The most important thing of being a doctor is keeping the patient comfortable. You never want to make them uncomfortable or build tension or make them feel like they told you something and they shouldn't have told you. You always want to steer clear of that. So if it's more comfortable for people to have a doctor of an ethnic background, that's what we should do. And we should really start bringing people to the table because it'll help. It'll help a lot of people come forward with their struggles. Thank you for listening. Have a nice day.
Hey y'all, my name is Morgan Harris and I'm a freshman. Doctors of Tomorrow has been helpful to me because it's really chill, like they don't stress me out at all, and I learned so much in just a short period of time. Diversity in medicine is important because it's good to see doctors of all different colors and all different backgrounds. Representation is important, period. Mentorship in medicine is important because it gives you an authentic point of view of how it really is like going to school for that long and being in the medical field. What inspired me to be in the medical field was a really good ear doctor I had. He was so cool.
Hi, my name is Naija Stokes, and I'm a junior at Cass Tech. And Doctors of Tomorrow has been helpful for me because I've been able to gain a mentor when I first entered in my freshman year, and they were a M1 student at the time. So it was a very nice experience to have someone who was going into their first year of medical school as I was going into my first year of high school. And throughout the program, I've been able to gain a summer internship with Henry Ford. So that was an amazing experience since I was able to view multiple surgeries. And without DOT, that experience would have never been possible. So I'm very, very thankful for Doctors of Tomorrow.
Hi, my name is Quintin Solano. I'm a third-year medical student here at the University of Michigan Medical School, and I absolutely love the Doctors of Tomorrow program. I am a student who benefited immensely from the mentors that I had in high school and beyond, and I am very grateful that I'm able to give that back to the Doctors of Tomorrow program and students. And it's very personal for me because my family is actually from the city of Detroit. They grew up there, they helped to build buildings there. And for me to be able to give back to that community that helped build my family and helped get me where I'm at today means a ton. And I'm very grateful for that opportunity. So thank you.
Hello all, I hope this video finds you in good health and I hope you're doing well. My name is Rico Ozuna Harrison and I'm a senior here at the University of Michigan. I was part of the second cohort of Doctors of Tomorrow students, currently studying for the MCAT, and I'm currently a member of the Michigan basketball team. Doctors of Tomorrow, really exposed me to, careers in medicine. It exposed me to the University of Michigan. Before that first field trip, I had never been here. And after that, I was like, I need to go there. Like that's kind of where I set my sights on. And with the help of, my mentors, they kind of guided me and gave me advice and talked to me all throughout high school. They kind of helped me along my path, really telling me what to do, what not to do, giving me resources, doctors to shadow, opportunities to do research. And I think that's a big pro about the program is that it's consistent. 9th through 10th grade, 9th through 12th grade, I had mentors, I had people that I could talk to, people that I could call and ask for advice. And when I got to college, those relationships got even greater. For instance, there was an M1 that was a mentor my freshman year. And when I got here, starting in my freshman year, we started to go to the gym, play basketball, go out to eat. And he was in his, I want to say he had just graduated, but now he's a resident. And I just know that, having an experience with him, being able to keep in touch with him and just being able to see qualities in him that I see in myself and that I thrive to be like. I feel like that's what mentorship is all about. I feel like it takes a lot to be a pre-med student here when you come from the Detroit public school system. And I feel like a lot of times students, they might get a bad grade, they might not do as well on a test, and they kind of get disappointed, and sometimes they even steer away to a different path. But I feel like Doctors of Tomorrow, with the help of these mentors, I've been able to stay on the right path. I have people who tell me, I struggled in that class too. oh, well, I got this in that class, so you're doing okay. Or let me help you with your plan for the MCAT. Just all of these little bits of advice really have helped me stay on track. Just having people really support me mentally, emotionally, academically, helping me adjust to college with organization, helping me, find help with my prereqs, and then not to mention the financial support I've been given, the scholarships. There were times when I needed help with books, and these scholarships really helped me to pay for books or pay for an MCAT prep course that otherwise I wouldn't have been able to afford, or even paying to take prereqs during the spring and summer because I play basketball. It's been so much of a help, and I'm in debt to the next student that is coming up, and I hope I can provide a similar mentorship to the next. So yeah, thank you.
Hello, my name is Susan Roblera Gomez, and I'm in the 9th grade. I will be talking about what I want to be when I grow up and why. When I grow up, I want to become a cardiothoracic surgeon. Ever since I was in middle school, I've been interested in the field of medicine. I found so many careers available in the field of medicine, but what took my interest were surgeons. I found it amazing how surgeons were able to look into people and fix a problem within them and save their life. Becoming a cardiothoracic surgeon is one of my biggest goals, and I truly hope I'm able to accomplish that goal with the help of Doctors of Tomorrow. Doctors of Tomorrow is available for anyone. Being a part of Doctors Tomorrow is a great choice. That is all I have to say, and I hope you all have a great rest of your day. Goodbye.
Hi, my name is Zion Jones, and I am in the 9th grade. Doctors of Tomorrow has helped me because one of the sessions in the program was about the lungs, and we learned about the alveoli. Because of Doctors of Tomorrow, I knew about it when we learned it in my biology class. When I grow up, I want to be a neurologist surgeon. Thank you.
Hi, my name is Kelsey Gibbs, and I am in my first year of high school. Doctor of Tomorrow has been helpful to me because it has helped me gain social skills, and I have learned more things about the body and what to do in situations medically. Doctor of Tomorrow means to me is a program that will help you take notes and understand more things about your body and how to proceed in medical school and how to be a doctor in general. And one thing I would like to be when I grow up is an anesthesiologist.